to or view this meeting while in progress may do so by following the instructions on the agenda and meeting notice. All right. So we have a busy agenda here today, it looks like. And I think the first thing on the agenda is our 5 o'clock appointment with Dr. Marsden to provide an update on COVID-19 policy for the fall 2021. Hi, Dr. Marsden. There he is.
Hey, everyone. How are you?
Good.
How are you?
Appreciate the opportunity to speak with you today. I know that you have a busy schedule, and thanks for squeezing me in on the agenda today. As we have during the entire pandemic, whenever we got new guidance before the school committee made any decisions around that, we would try to, get some feedback and reaction from the Board of Health and get a sense of what you're thinking based on what Mass DPH and DESE releases to us. So as you know, CDC came out with recommendations a few weeks ago for masking all K-12 students across the country. And I think that Massachusetts took it another step forward and looked at, what our data say and, what the vaccination data around in Massachusetts looks like, and not looking just at the country as one, one blanket over everyone, trying to figure out what makes the most sense for the state. And then, of course, they added the piece of local control to that, which is always interesting with their last guidance on the 30th. So we'd like to just really kind of go through quickly kind of where we're at and what we're looking at, and then get reactions from all of you. I know the school committee is planning on meeting next week to get some public input on this issue, and then probably schedule a meeting the week after that for a vote on what we're going to be doing as far as implementation for the school year. But as you know, the DESE came out with that joint DPH recommendation of making sure that all students that were unvaccinated would be masked. So typically, in schools, that's looking at pre-K through 6 kids, typically on the age group that are that have vaccinations. And then 7 through 12, those students that are vaccinated would be not required to wear a mask during the day. But unvaccinated students in those age groups would be required to wear a mask. Other issues around that, they've taken away the physical distancing requirements in schools, which I think was really a roadblock for many schools to go back last year. And they've removed that particular piece of their guidance. They don't feel it's necessary anymore. They've also put in there that students would be having lunch, if possible, in the cafeteria, and that elementary students could eat in the cafeteria with their mask removed, and then to put their mask right on after they finish eating. Another piece of it was busing. No matter what the vaccination status of a student or staff member is, that mask would be required on all buses as a federal requirement for the school year. So there's a lot of stuff out there, and I know that you've taken the time to take a peek at it, and we just think it's important as we're fortunate in this community to have a Board of Health that has public health and medical personnel on that really understand kind of the issues and can provide some feedback and some guidance around that. So I think that's where we are. We're still going to keep all the mitigation that we had in place this past school year with the ventilation, the pool testing, all that's going to stay in place. We feel like that's a really important piece to keep that in place with our kids, no matter what the decision is around masking. So we're committed to that particular piece, because at the end of the day, we all want to make sure that our students and staff are safe and healthy, and that's what we care the most about. So again, happy to answer questions, but really looking for your reactions and feedback to what DESE and Department of Public Health put out to us.
Thanks, Jeff. Any questions from the board?
I have a question. Oh.
I have a quick question. Will you require proof of vaccination, like for other vaccinations and flu?
From students or staff, or both?
Both.
So we actually get the information. Kathy gets the information from the state on whether students are vaccinated or not. So we get that information, and we're actually, I think the state is going to release a legal opinion on whether or not we can get that information from staff. So we're working on that as well, so that we'd be able to, we know who is vaccinated and who isn't vaccinated. I mean, Kathy probably knows better than I do. I mean, I think we have an extremely high rate of vaccination among staff. I know our vaccination rates in the town are really outstanding, especially across the age groups that we're looking at with high school. It's really impressive what our families and our kids have done around that. So I think that's important to consider as well. So yeah, we'll have that information for kids, and we'll try to get that from staff as well, Holly.
Yeah, we did do a survey towards the end of the year, I think 3 weeks before school ended, and 93% of staff who answered the survey, and almost everybody did. It was like 95% of people. So 93% were vaccinated, and of that, about 3 or 4% said they were planning on getting vaccinated. A few pregnant teachers that had put it off till they delivered. And so our vaccination rates are pretty incredible. One little blip at the middle school level of kids that have gotten a first vaccine but are not recorded as a second one yet with the state. And there were some cardiac issues right after those kids were eligible to get a first vaccine. So I think was a wait and see for some parents about getting the second vaccine, or they may just be out of town and planning on getting it before kids come back to school. We do have a link with MIIS, so we do have all that data downloaded directly into our software for kids. For staff, I did ask on our emergency questionnaire that they fill out every year. I did put a question on that. I did attend a seminar. It doesn't violate HIPAA to ask. You do have to put, just yes, no, or I prefer not to answer, which we have done. So we'll, again, the rate of our staff being vaccinated is very, very high, as with most age groups in Medfield are greater than 95%, the highest category. So as far as people, getting vaccinated, we're in really good shape in Medfield. And last year, most of our cases at the elementary level, again, very few, they came from adults, not from other kids. So having the adults vaccinated in town is a really good thing for our kids too. I should tell you, at the summer program, the summer guidance was recommended but not required for masks, and about half and half had masks and half didn't. I thought that might be an issue for kids. So, some having them, some not, but it didn't seem to be an issue. Didn't hear from any parents concerned that wanted masks that other kids didn't have. It didn't seem to be an issue over the summer. So that went well. The last point I wanted to make is just doing all of our state reports for the first time, I think almost 25 years I've been doing them. Masks really do work. They, certainly we had no flu, very little strep, no chicken pox. We didn't even have any lice, which was, not that that's an infectious disease, but just very interesting, the things that we report on that, we had a really good year health-wise. So what we were doing worked.
So Jeff, question for you. What's the requirement for staff being masked for, for those in contact with under 12-year-olds during the school year, and especially since we're now dealing with the obviously more contagious variant, even if they are vaccinated, I think there's some breakthrough infection issues too.
Yeah, so right now the guidance talks about unvaccinated staff members would need to have a mask, but vaccinated staff members would have the option. So that's what we have in the guidance. I think it's going to be an individual decision, I think probably based on, the comfortability at that point of the teacher. You think about if you have 20, 25 kids in your classroom and, whether they're masked or not. I think that's an individual decision that some teachers will make.
Was it more of a concern for, I'm not so worried about the individual concern with the teacher, but the kids themselves, if they're unvaccinated, and even if that teacher is vaccinated, it sounds like we're kind of learning things as far as breakthrough infections go and the possibility of still transmitting this once you're vaccinated with the new Delta variant. Wouldn't it make sense just kind of have all teachers masked if they're going to be in front of 12-year-olds who don't have that availability yet?
It could, Jeff. I'm just like, we haven't really discussed that at this point. I think, we're here to get that information from you guys. So that's, an important thing for us to consider. So that's good.
Could we just back up, Kathy? I just wanted you to clarify one of the statements you made about the cardiac issues for kids. I think it's important to just clarify that the myocarditis that they were finding has been
Right.
further studied and shown that it has been reversible in these children, whereas COVID-19 active infections have actually shown more longevity of myocarditis in children. I just want that to be.
Yes. Yeah, I think that it put some of the parents on pause, I think, until they
Right.
figured that out. So I think that's why we have just a little discrepancy in that one age group, that some parents, and again, it's a 10% difference. Some parents have just held off to see that. And it has played out that yes, indeed, probably, most of the studies are showing getting COVID, yes, your cardiac issues would be far a greater chance if you had COVID as opposed to getting a vaccine. But at that point, right after people got that first one, and most, people in Medfield, as soon as, their kids were able, went right down to, Osco and Shaw's, and we had a lot of our students go right in. But I think that that's what accounted for the discrepancy.
I think it's important for the listeners because they hear you had said cardiac issues and I wanted people to get a little more clarity. To speak to Jeff's point about masked individuals or the Delta variant and the transmissibility of that. So I think we're still learning a lot about the Delta virus, but from what information I've gathered is vaccinated people are very rarely transmitting or contracting. Since I think May 1st, CDC stopped tracking breakthrough viruses, but they have tracked patients who have been admitted to the hospital, and it's like less than 1%. So the vaccine is, certainly protecting adults and children.
Just a question about a process question. Obviously, it seems that you're interested in the Board of Health's perspective on these policies or Medfield's sort of decisions regarding these policies. And I think you mentioned that the school board would be the ones actually making the decision. Is there a timing, like in order for the Board of Health, to give its perspective and input? Is there a date scheduled for the school board for voting on that, those policies?
So Steve, I think we're gonna do a open forum type meeting or gain parent input next Monday evening.
Okay.
And then I think tentatively the following Monday is when Jess Riley and I met earlier this morning, and we're looking at tentatively scheduling another meeting for the vote on that Monday evening, which I think is the 23rd.
Okay.
If I'm not mistaken. We have a meeting already scheduled for the 26th. We're looking at moving it up so that we can make that, they can make that decision sooner.
As I just had the, in the last few days and in, preparation for this meeting and this agenda topic, I've been sort of trying to get back up to date with all of the streams of information that are out there. And we had a lot of actually input from people who wrote to the Board of Health. And so just sort of looking, taking into consideration each of those and some of the claims or concerns in those and tracking down, what from a, scientific evidence, what do we know from a scientific evidence perspective and a sort of a risk versus benefit trade-off perspective. And, to me, I guess I started from the position of thinking, well, compared to last fall, we're talking about 5 days of in-person learning for everyone with really no physical distancing. Well, 3 feet ideally, but pretty much not. That's pretty much normal physical distancing. And it seems like a pretty full educational program, including sports and so forth, with really, the only sort of compromise or the only ask of the children really, or the staff, it has to do with, getting vaccinated if you can, and wearing a mask inside if you can't, which seemed, much fewer precautions in a sense than we were taking before. But that's sort of commensurate to how the situation has changed with respect to the epidemic because of the vaccine being present and having a really high vaccination rate and low transmission in our community. So I think it's great news that, we don't have to, that we will be back in school full time, and, with, and the only sort of, hiccup, I suppose, that was reflected in some of the feedback that we received from the community had to do with concern about the children in the K through, I guess, through 6 or through 5 that can't be vaccinated, and having them wear masks indoors, and differences of opinion about whether that was something that was good or bad. And with, clearly opinions on both sides and so forth. And so when you go, I think I was trying to figure out, like, well, there isn't really a hard and fast rule here. It's not as clear cut as before about what to do, because the situation has changed from a year ago, and we know a lot more, but there's still a lot of things we don't know. But what we do know is that the death rate in children, in everybody, but especially in children, is very low. So that seems to be a fact that people agree on, right? That very few children die of COVID, even in the era of the Delta variant. And that it seems to be a continuing feeling that the children may transmit a little bit more than we thought, basically on par with adults in terms of transmitting, but they're often asymptomatic and they don't get seriously ill most of the time. And I had heard some reports about maybe the Delta variant is changing that and having a more impact in terms of health, symptomatic or serious cases in children, but have had trouble finding hard numbers on that. It seems that we know, I think the other thing we know that maybe not everybody agrees on, but I feel the evidence supports, is that masks are effective at slowing transmission of COVID. And now, in the past, we combined, and many schools combined, masks with social distancing and other kinds of precautions. And so sometimes it's hard to isolate exactly what the contribution is of masks versus the whole package of precautions. But I think the preponderance of evidence generally supports the idea that masks are an effective, they're not a waste of time, they're an effective prevention measure. So when there's disease present, wearing a mask probably makes people safer from that disease than not. And there's benefit both in terms of source control, in terms of a person who's infected transmitting to other people, and some protection for people who are not infected from getting infected. So it goes both ways, although maybe not equally both ways. But then there's the issue of, well, how big is the risk? Because there might be we got a lot of messages from, well, I'm not a lot, but but a handful of messages from people who were concerned about maybe that masks were had negative impacts on children, related to maybe making it harder for them to learn, and sometimes in particularly focused on certain children that might have special challenges that make the mask more of a hindrance. And I can appreciate that. I also, tried to look as best I could for, real concrete evidence on that. And what is unquestionably the case is that there was a big learning loss from people not being in school. Like that seems to be a fact everyone agrees on. And is well measured, but it seems less clear to me that there's really hard evidence of how masks affect learning in kids, in that age group we're talking about, 5 to 11. Some stuff maybe in the younger, 2 to 3 years old, but once you're 5 or 6 to 11, it's not really super clear that there's, now there may be particular cases, and I'm trying to think about, and I guess this is a long way of winding to a question, very long way, sorry. But, has there been thoughts about, accommodations? There are things written in the guidance, even from DESE and CDC, about accommodations for certain, learning situations or health situations where, there might be some bending of a mandated mask. And I was wondering, how you're approaching that.
Yeah, we'd approach it the same way we did the past year, Steve. I think we would, there are certain instances where medically it makes sense for a child not to have a mask on in certain programs, and we've accommodated that in the past. So I think we would approach it the same way. I mean, very, very few, but we did do that last year.
And that's good. I mean, I think at a minimum, you'd want to do that. And I should say also, I did see some evidence about, people wearing masks reporting, larger numbers of headaches and things of that nature. And it could, it seems plausible to me there could be some minor impact on learning. And here I'm talking about at the population level rather than for specific individuals. It could be quite significant, maybe in a few cases, but looking broadly at the student population, maybe there is it seems plausible, although I had trouble finding a hard evidence on it. It's surprisingly understudied, but that it has some negative impact. And I know, Kathy, you've often said that the kids have been really accommodating, and it doesn't seem to be a big issue for them. And sometimes maybe we project onto them because we're more fussy about having to wear the masks all the time.
Like most things.
Yeah.
Like most things, the kids did better, I
Right,
think
right.
than most adults have.
Yeah.
Now, even, again, with special needs kids in the summer, I had one student at Dale that did have a history of asthma and had more frequent mask breaks. That was really the only issue that we had at all.
And I guess so I guess if the question really is, I guess on the one hand, I certainly support the idea that kids and staff who are vaccinated shouldn't have to wear masks, but could do so voluntarily if they chose, if they felt more comfortable with that. I also think it's probably reasonable, at least at the start of the semester, probably to have the unvaccinated be wearing masks, including that younger group. But recognizing that, you know, it's not really a slam dunk either way, but there are, you know, when I look at sorry, Carol, I'll stop talking in a second. But when I looked at, you know, what data is there, you know, supporting, you know, wearing the masks, and you basically, you know, you did find that that the places that went back to in-person learning with masks, although most of the time also coupled with social distancing, but you know, they did not have very much outbreak. So it basically worked, right? Like we know you can go back to school safely with masks and social distancing. And now we're saying maybe you can go back safely with a mask and no social distancing in places that have low transmission and high vaccination. And that seems reasonable. There's also, you know, been places where, you know, schools that did not have a mandatory mask rule when they went back to school had outbreaks, more outbreaks than schools that use masks. And that seems to be the case. So then, you know, so that goes back to my idea that the masks work. And now it's just a matter of balancing that against, well, what is the risk on either side? So how negative is it to be wearing a mask? And, you know, what are the risks you're mitigating by wearing it? You know, and, you know, the risks for COVID transmission in Medfield are probably pretty small, because we have a really high, you know, 85%, I think, vaccination rate, you know, in terms of people who are old enough to be vaccinated. And we have, you know, we have what, about seven or eight cases per 100,000. So we have a pretty low case rate over the last 14 days. So we're not having a lot of cases. You know, so we're not sitting in an area of high transmission. So it might be okay to not have masks. You know, you will have probably some more COVID cases. It's definitely a possibility. And you might have more people missing days of school because of that, because you'll have, if you're not wearing masks it would be reasonable to expect some increase in the number of cases. And so you'll have more close contacts, because you're going to have people that aren't 6 feet apart in their desks. So you'll have a lot of close contacts for those cases. So you will, you know, you'll certainly lose fractional days of school and learning by not having masks. That's my hypothesis. That
Kathy, could you just talk a little bit about what the new quarantine rules would be?
Yeah, Kathy, maybe you should go for that.
So if somebody is asymptomatic, you'd still do the same contact tracing. It still would be 6 feet, but people who are asymptomatic can remain in school. You would just test them for 5 days in a row. So they wouldn't be missing school unless they were symptomatic. If they were symptomatic, they shouldn't be in school. So that's much better than it was with kids missing 2 weeks of school and never coming down with COVID.
Right.
So we really weren't seeing the transmission that we were concerned about.
So you wouldn't have, so the only people that would be really missing days of school then would be those that, you know, had symptoms.
Yes.
Or tested
So Kathy, to
positive.
clarify, is that from DESE or is that from DPH?
That's DPH.
So that, you know, so that might be not as bad of a downside as I thought. But anyways, Carol, you had some questions.
Well, I wanted to talk about the priority that we all have about all K through 12 students being in person. And in the health departments I work with, and I was just on the state call, they are maintaining the quarantine guidelines. So close contacts of someone and following the testing protocol and any kind of symptoms being out, even with vaccination, of many days in school. So I know we are not making any decisions here about what our recommendations are, and Jeff's got a great process going with a public forum, but we all want students to be in school and what the time in learning maximized can be. And I would just like to clarify through DPH, because that's what we are statutorily obligated to uphold, thank goodness for Kathy, but with close contacts, whether they're vaccinated or not. And there won't be any 6 feet distance. So I would just like to clarify that. And the other question I have for you, Kathy, and I missed it perhaps at the beginning, are you still doing the pool testing
Yes.
in 6 through 12?
We were doing it 4 through 12. We ended up doing, more than 20,000 tests, and, we didn't find any at the Dale Street level. So that's up for discussion, but no, it was very effective last year. I think it gave us all a sense of what was in the building too. But yes, the state will be paying for that again, which is really great.
Yeah, and they're outlining their plans tomorrow, and Kathy will be attending that webinar tomorrow to give us a sense of what it's going to look like in the protocols. And we're in discussion of expanding that to the lower grades as well, so that we could have everyone covered in the pool testing. So that's what we're looking at in the next week or two.
Can I just make one suggestion or point of opinion? I think everything that Steve has said I align with, and Kathy and Carol. Following DESE and DPH guidelines, doing masking for kids who aren't vaccinated, and giving the choice to mask or not to mask for the vaccinated students. But I'd love to add that if we could sit down and readdress this after everyone's voted, and allow us to have a reconvene session as school rolls out, perhaps October, November time, and whatever decisions are made by the school committee, we can, reassess either planning for more strict mitigations with a tiered approach, with following Medfield metrics, or perhaps even less strict mitigations, for example, maybe unmasking if we're seeing no transmission in the school system. I just like to have it sort of be a fluid thing, and not, we're doing masks all year without reassessing, would be my ask.
Yeah,
That makes sense.
I think either way, we'll be reassessing as we go along. If we're not doing masks, and certainly we're seeing more cases, we'd need to reevaluate.
Just a question back to Kathy, a clarification on the test and stay policy. So is that also the case for, that's also the case for unvaccinated close contacts?
Yeah, but again, it's only close contacts. Anybody with symptoms,
Sure.
who are testing positive, or if they're a close contact and have symptoms, can't be in school.
Okay.
Yeah.
But a close contact who is asymptomatic will get tested, but they can stay in school pending the results of the test, even if they're not a vaccinated person.
Yeah, and there was
Okay.
discussion on that. They were doing it different for vaccinated versus unvaccinated, but
Yeah.
the latest guidance will be anybody. Because we
see.
do now know after Provincetown, there can be, even though there's much, decreased risk of spread, there still has been seen spread with vaccinated people. So we'd want to know those kids, aren't positive.
Do you, I see that Jess Riley is in the Q&A and had a question. Do we want to turn to questions? Or do we have? Yeah, I lost Holly. Is Holly gone there, or is she just not in my view?
She said she's coming back.
Oh, okay, all right.
She'll be back in just a minute.
Can we
Yep, let
bring
me
Jess
provide that.
over?
Yep.
Hi there. Oh, I can start my video.
Hello.
Hi there. It has been so long since I've been on Zoom. This is amazing. I don't enjoy it anymore.
Lucky.
I am happy to be here. Hi. Actually, as I typed that in, I was really kind of at the same time listening to Melissa, and I do want to assure people, I guess, to some extent, that we do see this as a fluid situation, as we would with any health issue. And I really think that we would value the input of the BOH, and I think that we do intend to keep on revisiting where we are. You know, I think one of the things that Dr. Marsden and I talked a little bit about this morning was that there is no such thing as this is not one decision or another. It isn't that we're going to mask all year or we're not going to mask all year. We've really seen throughout this entire pandemic that things change very quickly. And even within the last 3 or 4 weeks, where we've seen that the Delta variant now, 93% of the cases that are being reported, and that breakthrough is actually very rare, but large. When you're looking at 200 million people, 100,000 breakthrough looks like an awful lot and has some impact. So, I mean, I just think more than anything, I kind of wanted to gauge, and I think that Melissa answered this, how interested we are in kind of continuing to understand what our trigger point would be for changing masking, like our masking recommendations, you know, and that we'll be really looking to you for that. Because I think that with such a large population of the adults being vaccinated and kids, we look pretty good here, but I also think that there are going to be people coming back from vacation. You know, the thing that kept us kind of able to be insular through most of the pandemic and kind of mitigate a lot of the cases that we had may also be the thing that makes reentry a little bit more of a risk, because now we are all out. I mean, you know, Melissa saw my pictures of Alaska, which was great, and my PCR came back negative, thank you. But I know that there are a lot of people who are coming back and may not be really thinking about, do I need, because there's no testing mandate, to come back into the state this year or anything. You know, the beginning of the year just might be a little bit more intense, and we want to be sure that we're being flexible, but we aren't setting a decision across the board, and that's just the way it is for the rest of the year. And, you know, the health of our kids is always the most important. And even one case that's serious is a kid. So just certainly want to reassure all of you that we'll be looking for your expertise during that time. And that's really all I need to say. My question turned more into a reaffirmation. And you can send me away if you'd like.
I don't know if we need to send you away. You can hang out if you want, or disappear. But I think I just want to hit there's another question in the Q&A, which is unfortunately from an anonymous attendee. So that person who asked the question, I think it's sufficiently, I'm just going to own that question for the person, because now that it's asked, I'm curious. It's, will teachers, therapists who move between schools, such as high school and elementary school, wear masks? Did that make sense?
Yeah, I mean, I think it goes along with what we talked about earlier when Jeff had mentioned that question to me. You know, we're looking into it, and if they're vaccinated, I think that's something we have to talk about. And obviously, if they're unvaccinated, they have to have a mask on whenever they're anywhere near or in our building. So we'll have to take a look at that. It's a very small number of people, but it's a good question. We'll take a look at that.
I mean, I think going back to this idea of assessing, you know, kind of in a continual way, and having some criteria for, you know, it seems to me that it's a prudent and I think, to my view, it makes sense to start out the school year with the policy that has the unvaccinated kids masked when they're inside in the classroom. And I think it's a good point to say, well, we ought to be able to at some point say, well, what would be the criteria to say, well, there's always going to be an element of you're just trying it and you may get it wrong because you can't observe the counterfactual. And if you wait long enough for the evidence to accumulate, the school year will be over anyways. So, at some point you're going to be, if you were to take the decision to say, you know what, our case rate in the community is stayed low and our vaccination rate has, continued to get, it's almost, it goes to, 95% or 90% from 85. I mean, it's already pretty high, right?
Yeah.
I think it's 79% fully vaccinated right now. So, but, at some point you might try it. And, I think there's some element of risk of trying it, but there, you'll never, in some point, you'll never know until you do it and find out that, oh, it's okay. And you have to be prepared, I think, for the possibility that, you do have more cases and it could end up being disruptive or, concerning from a health standpoint. And you might have to reverse course. I mean, I realize it was a different time that was pre-vaccination, but that's what happened in, some other schools, did switch back to having masks and precautions because they were having too many in school transmission happening. So we might, I think it's gonna, at some point, you're gonna have to make a decision to take the masks off that, is it's always going to be somewhat of a guess as to what's going to happen. I think clearly, you wouldn't do it unless you have low transmission and high vaccination, which is the situation we appear to be in now. And you might want to wait, like you said, for a little bit of time in the school year because you do have a lot of moving parts at the start of the school year, and maybe it is more cautious to start that way and get everybody comfortable. So that makes sense to me.
Yeah, totally.
All right. While I'm here, does anybody have any, while we're having these community conversations, does anybody have any feedback that they'd like to have us kind of bring up at that meeting, or you can think of?
Yes,
have,
would you want a Board of Health member there or anybody on the call with you guys?
Yeah, I was actually just,
Or Kathy, who can answer questions.
Yeah. I think
medically-
I don't want to make any decisions for Jeff's staff.
Right,
but,
I just didn't know.
I think it would be nice to have somebody certainly there from the BOH who can kind of give I mean, I don't think any one of us have ever said that we're an epidemiologist or a medical professional. So if somebody would like to be there and we want to have that discussion, I'm happy to. We can kind of talk about that off camera about who would like to do that and who would feel most comfortable with that. I'm happy to have that. So, yeah.
And I'd just like to add for us and for school committee and any group, the state is urging us, local boards of health, to really communicate in our towns to encourage people, if they have any kind of symptoms, to get tested.
Right.
And I've recently run into that with my own family. It's about where is it, when is it? And they're really encouraging us across the 4 towns I work with to put that information back on our website, to let people know that even to get any kind of symptoms, they should be tested, because they shared some data today. And we know that this COVID, even with vaccination, you can be positive. So the more we know, the better. And that's why I'm
Right.
grateful Kathy's committing to the pool testing. But as a community, for all of us as different sectors to encourage people to seek out testing if they have any symptoms or have been a close contact and they have that thought. And also to address any kind of vaccine hesitancy so we can bring the number of 12 and up people to the highest percentage we can. And I see that as our role in the Board of Health, a lot of communication around addressing hesitancy and identifying who we might need to reach out to. And the last
I would also
part-
say that, sorry, Carol, with as we are able to start thinking about elementary school populations and the kind of the additional concern that parents often have about vaccination, how we really help people understand kind of what the data is behind that and the safety, and that how powerful it is tested even before it gets the FDA
Right.
approval.
And the last thing is for us is to all be committed to doing that contact tracing, which Kathy has been, and we're getting a public health nurse, and, you know, to let people know that we're doing all we can to keep those percentages down so that the risk is minimal, but we're as different sectors committed to the same messages and the same procedures to test ourselves and to test the population and to address the vaccine hesitancy. So I appreciate being able to just collaborate and share those same messages, Jess and Jeff. I think it's vital.
Absolutely. All right.
Thanks, Carol.
Thank you for your time so much. I appreciate it.
And Carol, I like that would come from the Board of Health. Actually, the nurses were going to send something out just for that sort of 10% group, you know, at the middle school age. But I think it might be really powerful coming from the Board of Health. I really like that idea.
Yeah, I think we're constantly reaffirming that message, but if somebody else within town who is kind of a, you know, confirm, you know, can do kind of a confirmatory opinion, that would be helpful.
There's a lot of data and a lot of communication templates. So I think you know, faith-based groups, everyone can share a standard thing. It will be powerful because we would like to have as many people as possible, you know, certainly thinking about any kind of health restriction, but I see that as a really important role.
You know, many towns have had problems with pool testing. Obviously, we have had overwhelming success, but as we get into that elementary age, understanding that pool testing is generally non-invasive, not painful, and something that everyone can do with no cost and nothing but benefit. Really, that's really helpful too, that we can keep on pushing out that message.
I want to just say that there's a couple of questions here. I think we ought to take. One is that from Poppy Griffin, and I think maybe Dr. Marsden, you might answer this one. It says, would you speak further about meals and snacks for under 12 kids and masking protocols and physical distancing? That's the question.
Yeah, I would say at this point right now, we're looking at having snacks in the classroom as they always have prior, in that lunchroom. We're going to encourage lunch outside as much as we can, like we did last year. So I think our schools did a really good job when the weather was great to have lunch outdoors, and we're going to continue to encourage that. But then once we get back into the cafeteria, we've added additional air purifiers for the cafeteria, so that we'll have students in there and they will not have their mask on while they're eating lunch, and they'll put them, if they're, you know, if the school committee votes this way, they'll put their mask, you know, back on after they have lunch and go back to their classrooms at the lower levels.
And there's not during the lunch, there's not a physical distancing, right?
Correct.
Okay. Or at least that's the plan.
At this point, yeah. And I think, you know, we still have a few weeks to go here. And I think that, you know, sometimes, you know, things can change rapidly with this. So that's why I think it's really good that, you know, we have this meeting today. The school committee has their meeting next week to gather more information. And then, you know, they listen to their constituency and wait another week to vote to see what's happening. You know, things could change quickly with this. So we want to make sure that we give it the right amount of time to make a good decision, but also give parents enough time and kids enough time to plan for it.
Which is why we're moving those meetings up even earlier than we might have ordinarily, because we do really want to make sure that people know kind of what the plan is and allow them to have input into it and ask all the questions that they need to, you know.
And we have another question, or a couple, another question sort of on the other side. Why not mask? Question is from A. Sullivan. Why not mask all 7 to 12 students? What about the risk of transmission by vaccinated kids, which does exist? So this is, you know, the idea of having even vaccinated people masked, and you know, has that been considered?
I mean, I can take the beginning of that. You know, certainly it's been considered, but when you look at people who are vaccinated, their rate of spreading disease, is it possible? Yes, but it's far less than unvaccinated individuals. So that would be the reason for the difference there.
And it's possible that DESE will come out and do an across the board mandate one way or another. And then all of these discussions will kind of be moot for,
Yep.
you know,
Right.
and we know that from last year. And I think that we, you know, everything has to be said with that caveat that we are looking at the data ourselves and that these are local decisions right now, but, you know, the state may just choose to apply across the board. And that would not necessarily take our current data into consideration, but has to be made at a state level about, you know, full population kind of level as opposed to a local level.
But even at a local level, you know, assuming it stays the way it is now, where there's local flexibility, you know, just as we're saying, maybe it's prudent to start with masks in the unvaccinated, and then possibly reconsider that over time if, you know, at some point it seems like it's, you know, we're comfortable with, you know, taking that you know, risk and figuring out whether what will happen if they're not wearing masks, right? In the same way of having the flexibility of you know, becoming less precautionary in that case, you know, you might want to have the flexibility to become more precautionary with the 7 to 12 vaccinated, because, you know, you are going to find out in the first few months of school, you're going to find out, are there transmissions happening from vaccinated kids and so forth, right? So, and you may have to re-entertain whether masks are necessary potentially.
We're only talking about a short-term time here anyway with the under 12-year-olds. I mean, if the vaccine for them comes out late fall, early winter, something like that, let's say late fall. So by the time we're looking at this data, well, at that point, they're going to be eligible for the vaccine anyway. And that seems to be what we're focusing on. Those are the kids that are at most risk because they don't have that available to them right now. So why not be proactive right now, bite the bullet a little bit longer, and have teachers wear masks that are in front of these 12-year-olds that don't have the ability to get the vaccine. And then halfway done the school year is done, when the vaccine's available, then this is all a moot point. And it seems like we're focusing on data that's based on the Alpha variant and not the Delta variant, which everyone's just kind of getting new information coming forward. So again, it seems like we're being a little bit reactive and not proactive, and looking at this maybe just 6 months of time that we have in front of us. And that's really it. You know, once these 12-year-olds have the vaccine available to them, I don't think anyone here is arguing that the vaccine works for everyone who has it. Those who have it aren't getting as sick from it if they have the vaccine. It's just a matter of this 6 months before the 12-year-olds have this available to them, so they have the same protection everyone else does.
May I?
That's not clear yet, though. I mean, that's down the pipeline. And I don't know that requiring teachers to mask would be a recommendation. I mean, I think you'd have to get teacher input. If you speak to any of the teachers, there's a lot of reasons why they don't want to be in masks from an educational perspective. I don't just think making this global statement that all teachers in K through through 7 have to mask right now. I mean, I agree. I mean, I personally think about it the way I think about my kids. My 10-year-old, when we go into a store, I put a mask on him because he's unvaccinated. My 12-year-old is vaccinated, so I am fine with him not having a mask. And, you know, there are a lot of teachers that really feel strongly that they're not able to educate the way that they want to with a mask on. You know, I agree with Jeff. If they're very comfortable, if they feel more comfortable wearing a mask, that's a better option for them. But to make that global statement without the teacher input, I think is a little bit, I think they would need to be able to contribute what their opinion is regarding that.
Again, the masks the teachers be wearing wouldn't be for their own protection, it'd be for the kids' protection. You know, so that's what we're looking at. It's not, you know,
The teachers are
they're comfortable.
they're 95% vaccinated, right? And
Oh,
we have
I
a very
agree,
high
but
vaccination rate in that
some of the-
population. So
Some
why
of the
would you
data we're
require
getting
them to wear
now is
masks?
showing that there are breakthrough infections, and that those people who are vaccinated or infected are also have the ability to transmit that virus. So I don't think we have all that data in front of us yet. So that's what I'm saying. We're kind of looking at the older data we have to try to project out what's going on, and that might not be quite so accurate right now.
I don't know. Steve can probably answer that question better regarding the data.
Well,
This is sort of his
I think it's sort of, yeah, Jeff, to your point, it actually, it's somewhat more compelling, perhaps, to have teachers who are, even if vaccinated, bear with me. So even if vaccinated, I think you're arguing, even if they're vaccinated, because there's still a possibility of breakthrough and a possibility of transmitting, even if you're vaccinated, that maybe the teachers who are spending all day with a pool of unvaccinated kids should wear masks, because that would reduce the possibility of them transmitting to the kid a breakthrough infection or you know, to the kids. And that actually makes more sense to me than having vaccinated kids in the grades 7 to 12 wear masks, because they're sitting with a population that's also vaccinated, you know. But your example is this instance where you have, you know, a pool of unvaccinated people, the children. And that's one I'd want to think about a little bit more, Jeff. It just sort of work through the numbers on what the risk level might be. You also have the situation that there is a somewhat of a physical distance between the teacher and the kids, so they're not, you know, I mean, they're at points in time they can be quite close, of course, but it's an interesting point, and I'd want to think on that one a little bit. Yeah, Melissa, sorry.
Dr. McCullers here, and
That's what I was just going to ask.
yeah, she's here. She might want to pipe in for a second if possible. Thank you.
Sure. Yeah, Laura, come. Yeah, Dr. McCullough, come on over.
Thanks. Oh, there she is. Okay, perfect. You're still muted, Laura.
Can you hear me now?
Yes.
Yes.
Can you hear me now? Okay, good. Excellent. Sorry, I'm in a quiet place now. So I think all of the points that have been raised so far are really good. I think the problem is that there is speculation at this point. And Steve, you've done, I think, an amazing job of looking into the literature that really at this point doesn't exist yet, is the problem, is that there is speculation from the Provincetown outbreak that vaccinated people can transmit and transmit at the same rate that they do, that unvaccinated do, but there isn't really great evidence for that yet. It's simply speculation at this point. So I think we are basing all of our theories and conjecture on evidence that yet unfortunately doesn't exist. I think the difficulty and the problem with that is that, so then, you know, you default to the safe thing, you default to putting everybody in masks. And that seems well and good, except for the fact that, and again, Steve, I love your diligence in terms of how much you look into every single thing that there is. I'm not surprised that there aren't studies about kids and masks and impact on masks yet, because I don't know who would have gotten that done this year. I don't know who got anything done in the past year related to this. I will tell you anecdotally from any, you know, first grade, kindergarten reading teacher, the mask impedes phonics. The mask impedes the ability to teach. The mask impedes, you know, seeing, saying phonetic sounds and things like that at the younger levels. And I will tell you that universally, every single first grade teacher that I've talked to, and it's been several, both professionally and personally, have said that they pull their mask down to make the TH and the diphthong sounds. Like, you can't distinguish between a TH, a CH, and SH. And I'm using these examples because these are the ones that I am living with my rising second graders right now. And so there probably is an effect there, but isn't enough of an effect to say that we should not be masking all of these teachers. Personally, I think that you have to look at the risks and the benefits. And if you have, you know, people who are vaccinated that are comfortable not wearing a mask, I think that the risk of transmission at a distance, teaching from the front of the room, is probably not as concerning with all of the kids that are, you know, not likely to have significant outcomes at that point.
Just to be clear, I'm following you. When you're talking about the impact of the masks on learning, you're specifically talking now about the teacher wearing a mask. Am I right?
Yes, I think that unvaccinated children, like at this point, you know, as far as we know about Delta variant, so far it is not affecting children more significantly from what the data and the expert panels say. But I don't know that we've had widespread transmission in indoor settings at this point to say that it's not going to, Steve. And I think that's the point where I think that all of the points of all of this being a moving target is a really important thing. That this is going to be a conversation now, it's going to be a conversation in the middle of October, it's going to be a conversation over and over again as these moving target changes, as the moving targets change, which has happened to us all kind of throughout COVID.
Yeah, that's a good point too, that temporally you had the real rise of the Delta variant happen after
We've all
most
been outside.
we're out of school and we've been outside. So we haven't experienced school year plus Delta variant yet. Right.
And I will tell you that the indoor portions of summer camps, in my experience globally so far, both professionally and personally, have been masked so far for the unvaccinated. And so I think that is, you know, where our safe default will be for the unvaccinated. But I think there needs to be a recognition that there is a trade-off and that we need to kind of keep looking at this as we get more and more information. And I think it's so hard and so frustrating, and people are putting so many different things up from online and Facebook and looking for answers that temporarily we simply do not have yet. If that makes any sense.
And we saw, and I think there's also been some data around camps that did not use masks and having had outbreaks in those camps as well. But I don't know that data very well. That's still on my list to look at.
I think any data that I'm aware of from that is from last year. I haven't seen anything that's new on the Delta variant yet. I think simply because it hasn't come out yet. I mean, Provincetown is literally our first unfortunate data point. The other thing I would say, just to comment on things that I've heard so far, and I think it was Carolyn that was saying it, although I didn't have my video feed on. I will make a plea to all of us in Medfield, all of the parents in Medfield. The apathy that I've seen in the office recently and in personal settings of kids having symptoms and not being tested and not quarantining while a test is pending has been kind of through the roof. And that is where we are going to fall down in whatever situation we are in. So if we are going to succeed in anything, it is definitely not the situation where we motion up our kids and send them out to school. We need to absolutely 100% be diligent and focused on any kind of symptoms, no matter how minor they seem, making sure that our population stays safe. Mhm.
Any questions for Dr. McCullough? Or responses? Kathy, I see there is a question that I think you would be maybe positioned to answer from A. Sullivan about cycle thresholds and PCR. I'm going to leave that one to you if you know the answer there. Do you see it?
Yes, thank you. Yes, the testing that we do in pool testing is a PCR. We did, other than the very first week that we started pool testing, I think the state labs were sort of getting their ratios up or down, so to speak, so that there were less false positives. We didn't have any after the first week, and we do follow up the PCR pool. The kids will all have an antigen test. So then you have 2 positives. So you can be pretty confident that they, do have COVID. And most of our kids that tested positive from pool testing, unfortunately, we found out, usually after the fact, those kids had been symptomatic and then were picked up on pool testing. So yeah, that's something that we look at a lot. We didn't have a lot of cases we picked up, but definitely the ones that we did then were positive on the antigen test also.
So maybe it seems like we're maybe coming to a point to close this agenda item. I think maybe I'm trying to think of what the next step is. I mean, obviously you've heard a lot of viewpoints of the Board of Health as we've sort of discussed this for the first time. I don't know whether in the next 2 weeks before the school board makes a decision, if there's further input from the board or if we need to codify it in some way, if that would be useful. Thoughts on that?
Yeah, I think it's, ever evolving, right? I think that's what we're all kind of wondering what's going to be going on the next few weeks. I think, we'll have a good, on the 16th, when the school committee has the public input session with parents, they'll get a lot of information from there as well. I mean, it might make sense to touch base one more time before school committee votes with the Board of Health to just get a sense of, what you folks are seeing and what the data show, in the area or, in Medfield in particular. So it might make sense to do that, Steve.
It certainly seems like 10 days could make a difference.
Yeah.
In terms of what we're looking at right now. And I also think that it's incredibly important that just informally, if families can be testing when they come back from vacation, much like they did last year, although nobody's saying you have to, it certainly would help the beginning of the school year, I think. And this is, merely an opinion. Certainly help us at the beginning of the school year to know that we're coming in and we're coming in clean as we can be.
Yeah, I think it's just important to remember that, we still are going to have all those mitigating factors that we had last year in place. And in the pool testing, with all the information around the clean air, the fresh air intake, the air exchanges 4 to 6 per hour, like all these things that we put in place last year that really kept our students and staff safe will still be in place again this year. I think that's an important piece to remember. And I think that the big question is whether it's, we haven't had a school year with Delta variant yet. So I think that's the big question, and we'll have to see how that plays out. We'll know very, very quickly, especially at the high school level, with sports not having masks this year in the fall, we'll know very quickly with pool testing and all of that, what's happening within our schools. And I think that's the beauty of pool testing. And I think, the fact that we were successful with it last year, it really gave us a sense of the surveillance of what's going on in the district, and peace of mind for staff and for parents and kids to see what's happening in our schools. So I think we're going to keep doing that, and whatever we decide or with the masking and how that plays out, we'll still have those surveillance mechanisms in place to give us the data we need to have to make good decisions going forward.
Just as a point of clarification on the sports, I don't know, maybe there are no indoor sports in the fall, but what about masks on indoor sports?
Yeah, so masks are required for volleyball in the fall.
Okay.
All outside sports, no masks are required.
Okay.
And they're still working on guidance for our chorus, our band, and orchestra. That's been a tough one. I think the state is still working with groups there to make sure that they can get that guidance right. I know that we met with our music director, and we're ordering special masks for the kids that can use when playing wind instruments, which is something that is going to be really good for them to keep them, playing and hopefully not outside with 10 foot of space like they had to do last fall. So we'll kind of see how that all works out, but we're planning for that and waiting for that additional guidance for our students that are involved in music, chorus, and orchestra.
Holly, do you have a hand raised?
I do. I have one more question. In the vaccinated 7 to 12 population, will you be enforcing kids that are not vaccinated not wearing a mask? How will that work?
Yeah, I think it's not a lot. So that's the good news. The good news is not many kids in that age group that aren't vaccinated. But like we said in the beginning, we have that list. So we'll see who that list is. We'll contact those parents prior to the start of school so that they know that their child will be required to wear a mask, and we'll monitor that. It's our.
Can I jump in on that,
Thank you.
Jeff, for 1 second? Sorry, if I may. I think you'll find that kids, I know there's a lot of hesitancy between parents feeling like their kids are going to be singled out, but like we see at the grocery store, Blue Moon, that are people who are vaccinated are still putting masks on. So I think some parents will still have their kids masks regardless if they're vaccinated or not, because that's their choice, right? So it's not going to be the only kids in the school. I feel like that's a concern for, parents who, for whatever reason, can't get their child vaccinated. I think there's going to be a choice that their kids will have masks on that perhaps feel more comfortable that way.
I think that's absolutely true, Melissa. There will be parents that choose that.
Mm-hmm.
Yeah.
So should we close this agenda item and move on to the Bridget?
Thank you again, Stephen, for being
Thanks,
so
everyone.
Thanks a
Always
lot,
appreciate
Dr.
it.
generous with your time again.
Thank you so much.
Thank you.
And
Thank
Dr.
you.
McCullough also, thanks for coming over.
Mm.
So I think our next agenda item is Bridget's update, health agent update.
How are you?
Hi,
Hello.
Bridget.
Bridget.
Hi. So just again, another pretty straightforward, busy month. A lot of Form As, plan reviews, couple of septic plan reviews, a lot of camp questions, some weird other questions, but just business as usual.
Okay. Go ahead, Carol. You got to turn on your microphone though.
Sorry, it's nice when I don't, right? I was just curious what the water condition on the Charles River was.
Yeah, you and me both. There have been some complaints about, so the harmful algal blooms have sort of revisited this region pretty significantly this summer season. We've had a lot of other types of water bodies closed because of harmful algal blooms. So we did work with DEP to make sure that's not what it was. At this time, there's still no root cause, but Logan from DEP did determine that it was not what we consider a harmful algal bloom. I still don't have the exact details of what was happening. We did get several complaints from residents, and we did talk to the Charles River Watershed Association. But really all I can do is make sure that DEP is involved and that they assured us that it was not an HAB. So that's what that is referring to.
Wow. The reach and the variation is huge.
What do you-
Yes, and it's never one easy question.
Right.
So yeah, it's a little bit of everything, Steve. You know, public health is COVID, and then it's everything else. It's a jack of all trades, master of none.
Right, right. And the unpermitted camp,
Yeah, that was a little bit of a stress point, but there was a program that did not realize that they needed to be permitted, and luckily, due to some of our outreach and Nancy sort of sleuthing with some of the other sports association presidents in the community, we were able to target that down and make sure that that camp did not operate. It advertised as a camp. It was hoping to use field space. They sort of inferred that they had permission from Park and Rec. So it just took a lot of legwork to get it to not happen, which obviously is unfortunate when parents are planning to send their kids to camps. But camps are very, very regulated, and you can't just run a camp on a whim. So A, it's not fair for a camp to come to town and a fly-by-night operation. That's not safe for the children, and it's not fair to, all of the camps that do the right thing. But again, luckily, because of our relationship with a lot of the other sports association presidents, they worked with us and they were able to sort of stop that in its tracks. And then we're going to meet with this particular association in the fall and kind of walk through what requires a camp permit, what would require a waiver because it doesn't meet that definition of a camp, because people are still confused about that. And I don't think people go into it intentionally trying to shirk the rules. So just working with those associations to make sure they understand why it's important, not because we said so, but because we do need to promote and protect the health of those kids at the camps.
thank you.
Any other questions for Bridget? All right, thank you. Oh,
Is this where we ask about all this paperwork about a dog and water thing?
I included that in your packet just as informational. There was a letter from DEP that came that was CC'd to the Board of Health, just that there were some concerns about people who are walking their dogs down near the Wheelock site and not picking up after them. Anybody who knows me knows that I've been complaining about that for years, and we've been working with the Deposit River Watershed to do some public relations outreach. You'll see we retweet their information as part of our partnership to please pick up after your dog, no matter where you are in town, including the front of the town hall lately. Just an aside.
What?
Yeah, so we just ask that everybody be responsible dog owners.
if it's in front of the town hall, that's political speech. It's protected.
I might be taking that too personally. So we just ask that everybody clean up after their dog, but I just concluded it in your packet just as informational.
All right. All right. I'm going back to my agenda here. There was a lot of things listed under new business. And new business discussion, potential votes. We were going to have COVID-19 update. I don't know if we have any.
I didn't have anything specific for you. I just wanted, in case anybody wanted to have any discussion about it, I wanted to keep it on your agenda. I think we were all very positive in the spring that we could start to drop that off and take up some of our regular business, but clearly it's going to be an ongoing agenda topic for us. So I'll keep that. I'll have Nancy keep that on your agenda for you.
Yeah.
Could I ask something in regards to COVID?
Mhm.
Thank you. Sorry, through the chair, if I may.
Go ahead.
Thank you. Kathy, this is kind of for you because kids who have had COVID in the past 3 months, are they still are you taking them out of pool testing if, okay.
Yeah, that hasn't changed. Yeah.
And has anyone sort of said to you, because my child's still showing antibodies, they don't need a mask? Okay.
Because
That-
everybody masked last year, so that wasn't an issue.
I'm just
But
thinking
I-
coming into the,
Yeah.
It actually came up in one of the comments that
Yeah,
was
I've
submitted. from
heard
the
that. I was
public.
wondering if that's come up for you.
Was, is having had a confirmed COVID equivalent to being vaccinated from the
Yeah.
perspective of masking in school?
That's not addressed, so we would have to go by.
I mean, we just don't have enough studies to
Yeah.
say you're
Not
not.
part of the guidance, so
Yeah.
it would have to be
Okay.
vaccinated.
I just
Because
wanted to
they-
confirm that because it's come
Yeah.
up.
Because they still recommend people get vaccinated who have COVID, who have had
Correct.
COVID. That's just the general recommendation, so we would follow the same DPH guidance at school.
Okay, thank you.
And then we had the regional health grant update, if there is one.
Just an update. Actually, Tiffany sent me a message today that we should be hearing about that hopefully by the end of this week. As you know, back in the, I believe it was the end of June, we partnered with Needham and with Dover to apply for a shared services grant, both for contact tracing, epidemiologist, health nurse, a shared service coordinator. So hopefully we'll hear this week if that grant has been funded.
That's
Perfect.
awesome.
Yeah, it'd be really great news.
And does that mean that if we got that, would that mean that people who are employees who are being supported through that grant would be doing contact tracing in Medfield?
Correct.
Yay.
The goal was the CTC was going to end
Right.
in September, and now it's going to go through December, but the goal is the infrastructure for local public health and not
Right.
regionalization, the shared
Careful.
services.
Yes.
Yeah, and they said on the call today that they have permission to contact the applicants to let them know this week if they got these. There were 2 grants.
Okay.
So that would be really nice to hear.
Well, keep our fingers crossed. How about the public health nurse recruitment update?
So we currently have 13 applications that we've received. We've identified 4 for our first round of interviews. And as soon as we set those up within the next 2 weeks, I will talk to, I know several nurses on our committee have offered to sit in on a review panel. So we'll be setting that up within the next 2 weeks.
Perfect. That's awesome.
So 13 is good.
13 is good, not as big as we would like, nor as experienced as we'd like in that group, but we'll see what happens out of the first 4 interviews, and if we need to, we'll go back and re-advertise. I don't know if anybody else is, obviously we're in tune to what Mass Municipal is posting, and there are a significant number of towns who are posting not only for public health directors, but public health nurses. Everybody seems to be having the same issue with filling that position, which we're not surprised by, and something we had planned on. We're seeing a lot of retirements, both as public health directors and public health nurses, which, having lived the last 18 months, not shocked by.
It's not a terrible thing, Christine, if people come without a ton of experience, because it's a really autonomous position. So I think people are going to be able to, work
Well,
this through a.
No nursing experience.
Oh,
So yeah. So
we could talk. We can talk about that. Yeah.
no experience. I mean, no experience. So, but
Okay.
But you got 4.
I believe we have 4 that we've identified for an interview. So.
Yay.
Yep.
And I have a lot of faith that one of those grants, and there are 2 for Needham, Dover, and Medfield, will get funded. And then that's mentoring and guidance that all those public health nurses in Needham can give. And there's like 3 of them.
No, absolutely. And Tiffany and I have had a couple of very long conversations. She has offered to help us do some of the interviews and transition to a public health nurse, which is great.
Perfect.
Fingers crossed. Thank you, Christine.
You're welcome.
Then we have our next item is the Medfield Day booth.
Woohoo!
Carol had mentioned something earlier in the call about pushing information out about
Mhm.
the efficacy of vaccines, and that might be something that, because there's already the pre-made data sheets can be printed out, and that's a good way to, spread the word. Our numbers are good, excellent, but there's always a few people who maybe could benefit.
Has
more
anybody looked at that Mass Clearinghouse website or the mass.gov? Hi, yes, our expert.
Yay.
Not expert, but I did I did do kind of try to pull together a brainstorm by looking at available resources, looking, thanks
Okay.
Carol, on the academic volunteer public health corps who kind of have focused in on the CDC, WHO kind of information things. And they also, in terms of for local boards of health, I don't know if that's what you're also thinking about, Carol, they have a social media kit, which kind of brings back to the question of what's our core message that, or like, what do we want to prioritize and focus on? And from the conversation with the school board, whether that's also keeping the vigilance around testing, for example. So just like, I was just putting things together, like capturing, some people mentioned great ideas last time, so just to put it back up, like whether we want like a survey. And I'm happy to be a point person and kind of inherit the learning from past Medfield days, but also do a little bit of the stuff on the ground, whether it's stuff we want to make print or kind of that kind of stuff. So I'll offer the feet on the ground, but would definitely also would love those who have been in the booth, what has worked well, basically focusing on engagement, whether we have then other ideas that came to mind when I was looking at so there is materials like one directional information, but I was also just trying to think about engagement, because I feel like this is like a moment where for the first time, like there is a lot of interest in public health and more kind of potential for whether or not we want to highlight, do new things like this. And these are just totally brainstorm. So just take that, like, obviously there's the information, there's a contest, could be a potential short survey on a tablet. If there's a giveaway, whether that's a magnet, a pin, information, like something like that, whether or not there was like an award just to kind of highlight those in our public health sphere, kind of going off the call previous you had with the Board of Selectmen. What captured my interest was that conversation about like what the coordinated messages and how public health is really bringing together a lot of. And so I don't know if we want public health the opportunity to just have public health champions to highlight that, it's a team sport here in Medfield, even with the Board of Health, like in terms of the other kind of youth outreach or the schools, definitely people have a core interest. So, and then of course the traditional information. So whether it's unsung heroes or sung heroes, I don't know. I just felt like we had a platform this time. So I didn't know if it was just trying to brainstorm new ways. In terms of information, I like for the next, if we have a meeting before that, I'm happy to put together ideas. I started to look at like the CDC has some posters, not to gamify it, but like look like bright, colorful kind of, if we want to borrow some of those in terms of this Bobby and his dad are protected when they stay home, and look at them in different kind of situations. I know there's like a little bit of saturation that people have with the COVID stuff. So I was just trying to think of also how people would want to, I think the big thing is that you're also the human resources, people be excited to interact with especially board members who've been like seen it through and through. So making them available, but also having people who have information. Those are just thoughts when I sat down with the information out there and the kind of packets that, like with the mass.gov, there's a lot of videos. Videos on and for the Trust the Vax campaign. But I'm meaning like, but in terms of traditional, like a poster, and then having like a survey so people can give input, because just a way to kind of capture that interest. Those are just thoughts.
Something we're allowed to talk about via email, Christine, something that's more related to what we're going to do at the Medfield Day booth? Or is that sort of something we need to talk about in a public forum as well?
You mean amongst all of you on the board?
Yeah, so say we wanted to brainstorm some.
Absolutely not.
No.
So
Okay.
maybe I'm like really inspired. Thank you so much. Maybe
So grateful for that hard work.
maybe we have a separate meeting and only can we have it for this? Because I also feel it could include our messaging going forward with the vaccine hesitancy, the testing. So I'm totally willing to have a Zoom or whatever just for this topic.
So it seems, I want to bring in Bridget, who has her hand raised. One of the things that we talked about last time, which seemed like a worthwhile thing in terms of the survey, I think there is a sort of some kind of standard survey for the community that you do as part of a assessment of public health needs or priorities for the community. And that's something that might make sense to put as part of the survey. The other thing I'm getting is that it sounds like when we get to scheduling meetings, we want to schedule a meeting that's devoted to this in the near term, right? Okay.
What's the date for Medfield Day? Sorry, Steve.
I think it's
I don't know.
September 25th.
There you go. So, no, it's a good, so we probably should be meeting on it soon then.
Yeah, okay.
Creeps up fast. What, Bridget, did you have a comment or?
Yeah,
You had your
actually I
hand
did.
up before.
So a couple things. I actually have story mapping that we use in Franklin. We haven't made it live yet, but it is actually really helpful and it's all online. We can set it up on an iPad at the booth. And a lot of the things that Mina referenced, I already have access to. So what I can do, Mina, maybe you and I can meet one-on-one because that wouldn't be a conflict.
Okay,
That's legal.
perfect.
But the other piece of this is that if you want, I think that the community needs assessment survey is really, really a good idea. But I think it might be too much information for a Medfield Day sort of drive-by, if you will. But what I would recommend is maybe something like a Kahoot, and you wait till you get like 5 or 6 people around the booth, and you just do 3 or 4 general public health questions, and whoever gets it right, they can do it right on their phone or they can do it right on their own phone. And it just kind of gets people to think more about what public health actually is other than just COVID. Yeah. So we'll speak to those other types of, and they're really easy to make. They're really fast. I mean, we use it all the time with teaching and it's just fun and engaging. And then at the end of the day, you can see who got the most points in those sort of small snippets, and they can be like your public health, your Medfield Citizen Public Health Hero of the Day or something like that. And then the other thing to keep in mind is that NACCHO has already done a lot of this work as well. And there's an amazing video through NACCHO, and I can send that to you. It's about 2.5 minutes long, but it really just plays on a loop and it tells you all of the things that happen in the public health spectrum that no one knows about. So it starts with like a video of like faucet water and the water is dripping. And it's like, you get your water from here. And then it just kind of speaks to that drop of water all the way through the life cycle, but all the different parameters that public health touches in that aspect. And it just makes people think of public health differently, not of just, not just COVID, not just septic, not just canning. It really gives them an idea that it's more than just one person.
I love
it. I feel like Bridget has awesome ideas, my son. But I almost see this as 2 parts, right? And I, as a board member, like to be involved. So there's the Medfield Day and what the ultimate decisions are for handouts and ordering the materials and if there's a Kahoot or not. And then to me, it ties into the messaging that we want to push out, throughout this year with maybe what is public health and then also other certain things related to COVID and testing. So I think this is great. We've talked about communicating, so I'm really grateful, Mina. But I'm willing to have a meeting dedicated to either or both, because this has just been a whole lot of information in a short time.
Absolutely, and just exactly just in terms of the way I was thinking about exactly the same way, seeing Medfield Day as like the start of the Medfield public health campaign, whether those messages go out through like our channel, like our Medfield Public Access, to keep that message going, but that if we get the messaging right for Medfield Day, we'll have a strong campaign moving forward.
So I'm thinking on this topic, it looks like Mina and Bridget are going to connect, and that in a little bit, when we go to scheduling meetings, we'll schedule a meeting that's devoted to this Medfield Day planning, and maybe with a secondary agenda is like long-term strategy, or, you know, so we can sort of bucket those things and talk right at that meeting. Does that sound good? Okay. And then, so I'm going to move on then for now. Is that okay? So I think we have one potential vote here. Oh, sorry. The VNA summary is the next item, which we got in our packets, is the, you know, the reportable diseases. I don't, is there any other update? It looked pretty, and nothing shocking there. Okay. I'm going to move on, hearing no, nothing. Okay, so then there is Nancy, it sounds, Benatti, it sounds like there's one permit. And so I'm guessing we need a vote for me to come in and sign that.
Yes.
Yeah.
I make a motion for Steve to sign the existing permit, whatever that may be.
It's for the Steel Sports / Soccer Day Camp.
Yeah.
I second that.
All right. So Carol. She says no.
I
Okay.
can't vote today.
You can't vote today.
No, I'm not sworn in. I'd send an email.
Okay. Kathy. Holly,
Yes.
Melissa,
Yes.
and Stephen, yes. Okay. So Nancy, I'm, you know what? I'm actually looking at the only thing is that and maybe we can, I'm going to maybe try and settle this now, because maybe someone else needs to do this depending on when they need it, because I am in Maine until right now until the end of the week. So the earliest I can come is Monday.
The camp's not until August 23rd, so you have some time.
So that's okay. Okay. So I'll come next week on Monday, probably, or Monday or Tuesday.
Okay.
Okay. All right. Great. So that's solved. And approval of minutes. Nancy, I think that's you again. Do we have any to approve?
We do.
Yes.
Everyone got really caught up. We're making a huge dent in that backlog. I think we only have 2 left that haven't been addressed.
Right.
So I have 5 sets of minutes where the majority of the board has signed off on them. So they'll just need you, Steve, to take a look at them. I think I sent them to you.
Okay. I will have that handled by Monday when we meet
Right.
with the permit, and then we'll.
Thank you to everybody for for catching me up on that.
And so let's see. The other thing I wanted to ask, just in terms of next steps, was, are some of us wanting to follow up with Jess Riley about being in that forum or their meeting? How should we handle that? Like, we can't be there as a Board of Health unless it's a joint meeting, which is feasible, but I don't know if it's necessary.
So back when I was the chair, it kind of reminded me. So one of their people came on to our meeting today.
Yeah.
And spoke. If there are people on the Board of Health without like 1 or 2 that, I don't mean me, that want to or are available to answer questions, could that be the same thing without being a joint meeting? And it's probably for Bridget and Christine, but I thought
To answer that, yeah, no, yeah. I don't know.
I'll probably be attending just as the school nurse leader.
Yeah.
Kathy, I think it would be very wise to have you sit on the if you would be comfortable with it, sit on the call because you have the medical knowledge, you have the knowledge of the school system, you have the knowledge of the board. So it really, you've got it all, my friend.
Yeah, but so I'm gonna kind of have her. It shouldn't, in my opinion, it's a big meeting that there should be more than one person.
Got it.
Of course, I just feel support. That's my opinion. And 2 is not a quorum for us.
Yeah, and
Right.
again, I'll be there as the nurse leader.
Okay, so not as the Board of Health.
Well, I mean,
person.
I'm just saying I will be there anyway, regardless
Right.
of the Board of Health as the nurse leader. Yeah.
Right.
But there'll be questions that'll be school specific.
Steve, do you, I mean, I don't want to throw you under the bus here, but you've sort of always been our liaison with the schools and with Jeff.
Right.
I'm like, who's gonna volunteer?
Does
Yeah.
it seem to make sense to be the Board of Health representative? And again, you know, I don't want to do that, but you have been the, unless you're away or you don't want to do it, we can all have a conversation, but it seems to make sense to me.
No, I mean, I'm happy to do that if you're all, you know, I think, again, you know, when I do those things, I try to be careful about, you know, like I think they're, you know, about saying things that as if the Board of Health agrees with everything I'm saying may not be the case. And so I try to be cautious about that, but you know, I know that, yeah, anyways, I think, and this is a question for Christine, but like if the 5 of us were on that call as residents of Medfield and could ask questions and so forth as they see fit, or right, but could they be asked questions? I mean, you know, it seems like you'd be in a gray area and you'd probably have to have a joint meeting if we're all going to be there.
Not even, you don't have to have a joint meeting, but I would feel more comfortable if your meeting was posted. You can post separately that you'll be in attendance at the school.
I see.
Mhm.
Okay.
Because my concern is people know you're on the Board of Health. If people ask you questions, none of you want to say, no, I can't answer that, especially if you have the answer. And that technically, once you start answering those questions, it could be construed as the deliberation amongst the board. Even though you're not taking a vote, you're still giving an opinion as a Board of Health member. I think you just post the meeting on the 16th, and if more of you go and you have a quorum, then you know, you're covered to have any discussions about that.
Okay.
We have to ask permission for that from Jeff to be posting that meeting at the same time?
No,
Jeff.
because you're posting that you're going to attend, and I'll let him know that you're attending their meeting. I would just say if all 5 of you are in attendance and you're going to talk, then I would just have you call that meeting to order, that you're in a meeting.
Right.
Yeah,
That makes sense.
I'm interested in just listening in. You know, sometimes they do that with selectmen. So I think you asked a good question, Steve, and thanks, Christine, for that clarification.
Great.
I also, you know, I don't know how that will be Monday, the 16th, and then they will vote the next week. Last time we went through all this, I don't, and I can stand corrected, certainly, we didn't ever take a vote on we recommend or mandate you as the school committee do X, Y, Z. So, right, thank you.
No, we've never ended up voting, you know, we've had a lot of meetings like the one we had today where we discussed the issues. And I think that, you know, that a listener of that meeting can get a sense of the opinion of the different board members. And we did have, of course, the one time we had the joint meeting, where we were sort of specifically going because where the school board was asking for our input as a board. And so we met together, if you remember that. So but we've never sort of taken a vote on a position with relation to a school policy, which that
Right.
is.
And I appreciated what Jess said at the end, because it could be that the governor and DESE come out in a week and make a mandate, and he has given them, the authority to make those decisions locally.
Yeah.
But we
I think that's what
always,
they're hoping for.
Right.
I think they're hoping for something, guidance from the state. I think it would make their lives a lot easier, but
right,
we'll
because
see.
there's so many different towns now, even today, Arlington, and, very varied. And I think it's difficult. And having the, so being able to, I'm happy to be there, and I appreciate Christine clarifying what our procedural stuff is. It's difficult. There's a lot to consider. I did notice the American Academy of Pediatrics recommendation, and so there's a lot to consider. And Kathy, we're really very fortunate to have you as the school nurse leader as we start again.
I mean, I think I think one of the things that we ought to do as board members over the next couple of weeks, if we're paying attention to this issue, attending the forum or gathering our own evidence or hearing from the public, it seems as though it's unlikely that we would, unless we could either decide right now that we're going to purposely schedule a meeting that falls before that, other than the one to talk about Medfield Day, in order to further deliberate. Alternatively, I think this is legal, feasible, asking Christine, but another approach would be if we're generally okay with where we left the discussion today, and what we hear going forward in terms of the open forum and the school board and so forth, then we could just leave it as is. But if someone on the board had a feeling that that there was something that was concerning to them, that they thought that the board we ought to discuss and go a different direction, or they had a concern about a further concern, then I wouldn't know that, because we're not talking. I think you could tell me, you could communicate with me that you wanted to have a meeting with that on the agenda sooner rather than later, sort of like an emergency meeting, if you will, and that would be okay. Or if that, I think Christine is nodding yes, that's okay. If that's not okay, then the other approach you could do is tell Nancy and Christine that that you wanted to have a meeting on that topic, right? That would, I don't know.
I don't think it would qualify as an emergency.
Right. Sorry, I made the wrong term, but
yeah, we could do a 48-hour.
Yeah, I didn't mean emergency in that sense. I just meant like a meeting that we haven't scheduled yet. But it would not it would still have the appropriate notice. Right.
Right. Good. Yeah.
Does that sound okay? I'm only saying that because I recognize that over the past year and a half, there's been times where sometimes people have wanted to weigh in more than they felt they were able to, I think, at different points in time. And I want to, so if you're feeling like there's more to say, or there's something that needs to be raised that hasn't been, then, just we should make sure we know that so that we can try and accommodate that.
And it almost seems after Monday, the 16th, I mean, this board needs to be candid, right? And have the opportunity to say, oh, although doesn't seem that as in the past that going forward we would vote, but we may be asked to have a recommendation, or as we were in the past, and how are we going to handle that? And that would require a 48-hour notice for a meeting.
Right.
It seems like once they have a plan and once they sort of, after this open forum and they have what their recommendations are going to be to the school committee, you know, if we have issue with that and we think that we need to weigh in as a board and we are not, we have concerns about their recommendations, we should probably weigh in.
Yeah.
You know, otherwise sort of by not voting, we're kind of given, or by not intervening, we're sort of giving our blessing on their recommendation. That's how I interpret it, or how they want our involvement to be.
Right.
But we don't know the plan per se quite yet, and it may change with public input. You know, you never know.
Right.
So
Right.
I think it's a little too early to tell. And then hopefully the state will come down with some mandates, and it'll be a moot point. But for
Right.
their sake, anyway.
I don't know. I hope the state doesn't, because each town has such different vaccination rates. So I'm hoping we get to make choices for our own community.
Yeah, and there'll be teacher input also.
Yeah.
But what I'm hearing Holly say is that we wait for the
I think that's
Monday,
important.
we all attend if we can, we post it, Christine can post it, because in my opinion, through public input, I think a lot of people are telling me that they'd like some medical knowledge on that call, or at least someone to be there to represent those questions that are going to be answered, need to be answered.
I would assume also that the school committee will have their own doctor, which represents them. I assume they will have Dr. McCullough, obviously Kathy, you there, but Dr. McCullough will be on that call.
Yes.
Yeah.
So what I'm hearing Holly say is between that meeting and the meeting where they vote, if something that comes up that doesn't feel right, that doesn't sit right with the Board of Health, then we can schedule a 48-hour meeting to intervene. Am I
Good.
hearing you right?
That's
How I see it. What does everybody else agree with that?
No, I
mean,
totally agree with that.
Yes.
Yep.
Yep.
Okay.
Thank you.
Good. So
Perfect.
that leaves us with scheduling 2 meetings now on our calendars. One, which would be that would be sort of exclusively dedicated to Medfield Day planning and Medfield's public health strategy. Right? And so we've been meeting on Tuesdays at 5. That's our regular meeting. So we would probably not want to do it on the second Tuesday of September. Well, that might actually be. When is Labor Day actually?
The 7th? 6th.
6th. Okay, so we probably don't want to have our next meeting, I think, would be on the 7th of September, but do we want to do that?
That's Rosh Hashanah.
Oh, so do we want to change that meeting?
No, I'm just mentioning it. It's that we don't have school that day.
And if you want to, I'm sure you'll be ordering things, Mina, and you probably want to know beforehand, right?
I switched. I'm sorry, Carol. I jumped to our regular meeting because that seemed easier.
Sorry.
But maybe it's not. So normally, if there was nothing weird in the calendar, normally we would just be on the 7th of September at 5
That's
o'clock.
fine with me to meet on Rosh Hashanah.
Okay. Is that everybody okay with the 7th of September
Happy
5 p.m.
at 5 p.m.?
I'm sorry, I just missed. What's the topic for the 7th?
That's our regular meeting. That's our regular time to meet.
Okay.
So the topic would be just sort of like the health agent update, et cetera. And probably I would put Medfield Day planning on that calendar as well, on that agenda as well, because undoubtedly there'll be some stuff there to talk about there. And, COVID-19 update. And I guess we'll see if there's other topics that arise.
Can I add something to that agenda if we're not totally inundated with COVID stuff? I wanted to add something about heart safe communities that I can give like a brief overview.
Heart
for
safe.
Medfield.
Yeah.
It's called Heart Safe Communities.
Safe, okay.
I've often
And I'm
wondered
happy,
about
it was
that.
part of my thesis and I sort of,
Oh, cool.
yes,
Okay.
and I don't know if I'd have to do some I want to propose it to everybody first, and then I have to do some research, and I'd like to meet with Jeff Bonatti. I don't know if anybody has an in with that guy on this on this call to talk about it. But it's basically, long story short, it's about educating community members about CPR and AED use without per se certifying them. And it's a program that started in Massachusetts. It was part of my thesis, and I just want to talk about that a little bit.
Cool, okay.
And
That's
would you
good.
have information that day on Medfield Day about, from the Heart Association or something? As a prelude or?
I could. I want to talk to all of you guys and see if it would be something that we would want to, by we, I mean me, pursue for the community. I don't know. I don't really want, I probably can't get into it in detail because it's not on our agenda. But the next meeting, I can give you like a brief overview of what it means for small towns and how it's important. I have a nurse that I work with that had done it for her community, and I have a little bit of extra time. And so I was thinking about promoting it for Medfield and talking about it. There's a whole protocol you have to go to be designated as a heart safe community. And you work with your paramedic services, and basically the long and the short, you just kind of empower people to start early CPR and use the AEDs that are around town. And so people don't feel so intimidated before your medical team get there. And it's shown really great results in a lot of communities. But you have to have a certain percentage of the population who are CPR certified. And you do little programs, public outreach, and that kind of thing. And we could talk about it at Medfield Day if it's something that we want to think about.
All right, I put it on the agenda.
Thank you, Holly. Looks cool.
Thank you.
Okay, so that's our regular meeting. That's September 7th, 5 p.m. So then for the Medfield Day focused meeting, how soon do you want to do that? Next week, or do you want more time before that? I don't, Mina, I'll maybe let you drive the boat on what do you think is best.
Hey, Bridget, I had sent you an email just in terms of probably after Bridget and I meet would be the only constraint, and then a few days. Mm-hmm.
So
I don't want to put you on the spot, Bridget, but if that's
Maybe 2 weeks.
So then we could say, so how about to be safe on that? We could do the week of the 23rd.
Yes.
If we wanted to do the Tuesday at 5 p.m. slot, that would be the 24th. But we wouldn't have to do it then. Any objections to the 24th of August at 5 p.m.?
No objections.
All right. So we have the Board of Health meeting for the 24th of August at 5 p.m. And the agenda for that would be Medfield Day planning and longer term strategy.
Mm-hmm.
Does that sound right? Okay.
Perfect.
All right.
Woof.
I think we've reached the end, unless there's something I missed.
Great job. Thank you all.
All right. I will need a motion if we want to leave this call.
I make a motion to adjourn.
All right.
Second.
Okay. Holly,
Yes.
Kathy,
Yes.
Yep.
Melissa, Stephen, yes. All right, we're adjourned. Thanks,
you.
everybody.
Bye, everybody.
Thank you.
Bye.